Tonight, our topic is going to be discussing perimenopause and menopause. And it's something that I think really needs to be brought out of the shadows and into our everyday conversations. And so that's one of the things that we're going to talk about tonight is we're going to talk about menopause. We're going to talk about resources for people that have questions about menopause. We're going to share our own personal experiences about perimenopause, those years leading up to menopause, and menopause itself, and just women's health in general. And so there's been a lot of talk in the last few years about women's health, and it's not been given the same resources, whether it's, money that they use for research or whether it's time spent in your medical schools teaching about women's health. There's definitely a gap when it comes to information and education about women's health. In this particular time in our life, perimenopause and menopause seems to have one of the biggest gaps. And so even in my research that I've done, even our OBGYNs that, focus on women's health will tell you that the information that they got about perimenopause and menopause, is oftentimes only 1 to 2 hours of education about this incredible time in a woman's life out of 8 years of medical school and medical training. And so that's been really interesting to me in the research that I've been doing is how little time, attention, energy, finances, and focus has been given to this really important and pivotal part in our life. And I'm going to talk a little bit about, Courtney and I are going to talk a little bit about society and how it views that. And we're just going to kind of bring this conversation into the forefront.